Okay, we're back with Dr. David Fox, vascular surgeon in New York City. Today we're talking about the process for treating varicose veins from beginning to finish all the way through aftercare. So Doc, if you could give us kind of the round trip tour of what it takes to get these varicose veins taken care of.
Sure. Well, the process starts with an evaluation in the office, which is done by myself. I'll ask the patient for the history of the vein problems, find out how long the problems have been going on, how the vein problems are affecting their life. Many times patients will have pain and aching related to periods of long standing, people who spend a lot of time on their feet. Oftentimes pregnancy will result in significant varicose veins. And then I'll do a physical examination so I get a good understanding of the veins that are bothering the patient, and try and get a good understanding of how best the patient can be treated. We'll follow that up with a duplex ultrasound examination to help understand exactly what treatment options will be best for the patient. And then we'll discuss the findings of the ultrasound examination, and I'll make a recommendation for treatment.
When you talk about the ultrasound, what does that involve? I mean, what are you looking for in that examination?
In the ultrasound examination, we're looking at the venous system in the leg, and the venous system is composed of three parts: the superficial veins, the deep veins, and what are called perforator veins, which connect the superficial and the deep system. Most patients with varicose veins will have problems with the superficial venous system, and patients with abnormally functioning venous systems will oftentimes be a candidate for treatment with endovenous ablation.
Okay. So after the diagnosis with the Doppler, then what's the next stage?
At that point, we'll discuss the proposed treatment. If the option is endovenous ablation, we'll need to begin a process of authorization through the insurance company. This is a procedure that is covered by most insurance carriers. They will, however, want the patient to go through a process of authorization. This will involve sending them a case history. The insurance company will want to receive copies of photographs of the patient's legs, as well as the results of the duplex examination. Generally, the insurance companies will want patients to go through a period of conservative therapy prior to authorizing the procedure. This will generally include wearing compression stockings for a period of time, and other times they'll want to see if the patient has had benefit from medications such as acetaminophen or Motrin.
And then for the actual treatment day, when they arrive for the day when you can finally do the treatment, what's the process?
On the day of the treatment, we ask the patients to apply a topical anesthetic cream a period of time before the procedure. Afterwards, they'll come to the office. They'll go to the procedure room where the treated leg will be cleaned, and then a sterile drape will be placed over the leg, and the vein to be treated will be identified with ultrasound. Additional local anesthesia will be given. The laser fiber is threaded into the vein, and the fiber is gradually withdrawn, closing off the vein. After the procedure, another ultrasound is done, checking on the adequacy of the procedure. Afterwards, the leg is bandaged and a compression stocking is put on. That compression stocking is worn overnight. The next morning, the stocking is removed, the patient can shower, and a clean stocking is applied. It's very important for the patient to walk after the procedure, so I ask the patient to walk for about 20 minutes after the procedure, and for the day or two following the procedure, the patient should walk 10 minutes of every hour while they're awake to help stimulate the circulation.
Very good. So the entire time of the actual procedure is how long would you estimate?
It varies depending on the number of veins we're treated. In some patients, the varicose veins are related to one vein, most often the great saphenous vein. Other patients will have multiple superficial veins as the cause of their varicose veins, the great saphenous vein as well as the small saphenous vein. A number of patients will also have perforated treatment as well.
Okay. Very good. So that's the process for treating your varicose veins.